Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Bettina Reed. She's a family nurse practitioner, and today's Kevin MD article is The Hidden Crisis in Healthcare, How Corporate Greed is Destroying Patient Care. Bettina, welcome to the show.
Thank you for having me, Kevin.
All right, so just briefly share your story and then talk about your Kevin MD article for those who didn't get a chance to read it.
Okay, so I'm a family nurse practitioner, and I've been in medical field pretty much my whole life, as my father was a family physician practicing in rural America. I worked in many different areas. I work in hospitals. I've worked in primary care most of my career. I've done federally qualified health centers, and I now work in corporate health and also work hospice on the side. I really am very passionate about patient care. I'm a strong patient advocate, and I'm also a strong advocate for just healthcare in general, because I was raised where that is a relationship between the patient and the provider, and it's very precious. And it's an honor to be able to take care of people. So when they invite you into their lives. So I really have seen so many changes over the years. My 33 years since I've been licensed really has shown when we've gotten a lot of more corporatization of healthcare, a lot of big health insurance, since we've gotten prior authorizations, we've gotten copays, we've gotten referrals, we've gotten things we never used to have. We simply used to have an office where a patient came in or wanted to see the doctor, and they paid a $45 visit and saw the doctor, and the doctor wrote what they thought they needed, and the patient went home. Then they would file their $45 visit with their own private health insurance and go get paid. Mm-hmm. That's the way it used to be. And it was still that way when I started practicing. And when we saw, so the reason I wrote this article was triggered a little bit because my daughter had just graduated, and she's an RN working now in an ER, a busy ER, level 1 trauma center here in Richmond. And there was so much violence in February against healthcare providers across the United States. And we were talking about it. It was just so tragic. Patients lashing out against those people who were there to care for them in the ICU in Pennsylvania, and the nurse in Florida. Poor doctor who was stabbed in the chest had to be med flighted out. I mean, it's just tragic what has happened. But we are the face of what people see when they come in for their care. And they don't understand this complex system. And it really is. When you're a medical professional, you know what goes on behind the doors, but they don't see that. Yeah. So we all know it's broken, and they think it's our problem, that we've kind of done this to them.
So you've been practicing for 30 plus years. Tell us about some of the corporate influences that you're seeing that really interferes with what's really the core of medicine, that relationship between clinician and patient.
Right. So I'm glad that was really the crux of it. Is I'm very strong in that patient-provider relationship. And over the years, when Blue Cross suddenly went for profit, and we started having to justify ourselves or justify our decisions to somebody like way up there who has no idea what we're doing in a room with a patient, and then explain it and send records and try. We had to become fighters for getting medications, and fighters for getting tests, and fighters for getting appointments against someone who really wasn't even in healthcare and didn't even understand anything about this provider-patient relationship. So when the corporatization started coming in, I was in private practice then. Started seeing a lot of changes because my father was also a family physician, and, we talked about the billing changes and the new expenses that came in, and how you couldn't negotiate with insurances because everything suddenly became like you charge $45 for a visit and they'd reimburse $17. You'd send out someone for an MRI and it'd be like $4,200, but if they cash paid, it'd be $1,800. That sort of thing. then I started asking a lot of questions, just, why is it this way? Why is this game kind of become? And you start learning about, that HAC Reduction Act and
Hmm.
all the hospitals not paying for or reduced payments for any infections or complications that patients get in the hospital. And I found that out when I had to send a patient for x-rays, and he
Yeah.
called me a couple weeks later and said, I got a $3,000 bill. Why is that? And I called the hospital. I said, don't worry about it. I'm sure it was a mistake. I called the hospital. I said, you probably billed them for a CT. And they said, no, actually, they passed this law.
Hmm.
And now we have to foot the bill for all this inpatient care. So we've had to turn around and raise all these prices out here just to try to break even.
Hmm.
And it kind of made me look and start researching. And sure enough, that's kind of what happened. And as time goes on, you start, everyone out there practicing medicine knows the struggle of trying to get medications for their patients. And one year we had 75, we got a letter said 75% of your medications are going to require a prior auth.
Mm.
And I sat there with a prior auth for a medication on the Walmart $4 list. You start researching and learning, and you start wondering, where is all this money going? Because now we have people paying monthly premiums that are going up every single month.
Mm.
They're paying deductibles, which means you really don't have health insurance until you've met your deductible. Then it kicks in, and normally that's that 80-20 thing.
Yeah.
So where is all this money going, And it really is going into a very for-profit system where up top they're making 20, 30 million a year salaries and lobbying in the government with millions and millions, hundreds of millions of dollars. That I researched that too. JAMA put that out because they
Yeah.
researched it. And it goes directly into our senators and congressmen's campaigns and pet projects. So they're not going to pass legislation to regulate an industry that they're making money from. And it ends up putting a provider and doctors and nurse practitioners and all of us in a very, very smothered role.
Yeah.
Where we have the knowledge and the expertise, and we are in the room with the patient, and we're the ones with the skin in the game doing the things. But we really don't actually have the final say.
And how does that make you feel as a clinician when you're in the exam room talking to a patient and realize sometimes you have to justify your decisions, you have to go through the whole pre-authorization for both medications and ordering tests? How does it make you feel as a clinician taking care of a patient, knowing that there's layers of bureaucracy that separate both of you?
So I'm a very easy to get along with person, but honestly, it makes me think that they think I'm stupid up there, that
Hmm.
I have to justify all the stuff I've learned to them when I'm the clinician. It makes me feel like they think we have no knowledge at all.
Hmm.
And I've many times, I quit a job once simply because they told me I couldn't send in my patient's Zoloft, and it was on a Friday.
Hmm.
I was at a federally qualified health center, so they received federally qualified money. So we had a lot of boxes to click, lots of rules to follow. But I sent in her Zoloft. I was going to see her in a couple of weeks, and I got a call from our pharmacy director, and he said, "Bettina, you can't send in Zoloft for her." I thought, that makes no sense. Why not? He said, because there's a government rule that you have to have seen them in 12 months in order to send in the script.
Hmm.
And I told him, I said, no problem. I'm seeing her in 2 weeks. She was coming in last month, but son got sick, so they
Yeah.
swapped appointments. It's covered. And he said, no, we're going to discipline you. You cannot do it. It's a law. And I told him, I said, you know what? I'm doing it anyway because I'm the one caring for this patient, and that's sorry patient care. And you do what you have to do, and I'll do what I have to do, but I really don't work for a little government guy up there. So I feel like that really good patient relationship with their provider has just been sullied by people who really aren't in healthcare. And I don't feel like they should have a say in it, to be honest.
So, what are some ways that you push back? And you told your story about the Zoloft, where this happens across the country so often, every single day. How can clinicians push back about some of that bureaucracy because it's overtaking almost every part of what we do every day?
It really is. And that's where, I mean, clinicians are frustrated. We spend so much time on all of our administrative tasks. And personally, I just won't do stupid stuff. And that's where my line is. If it affects my patient care, I'll just tell them I'm just not going to do it. You write me up, you put it in my little file, whatever you want, but my patient care is going to continue. Now, I know a lot of people can't do that, but I feel like we have the power. This is our field. We have the knowledge. This is where we shine. This is
Mm,
where we actually run things. We care for these patients. We come into medicine in a service capacity with compassion and love and care. I mean, we should make money at it too, because it's what we do. And we sacrifice a lot of time and education to get there, especially a lot of physicians, just decades of their life.
hmm.
You should make that money. But to have to then answer to other people and click all those boxes, I understand there's some thought process to it to justify, but it really ends up degrading that doctor-patient relationship so that you spend more time worried about, hey, did I click those HEDIS measures so that management's not going to come like snag me at the next meeting? It really degrades that time spent where you could actually use your knowledge care for a patient.
Now, you mentioned earlier that as difficult as it is for clinicians, patients in our healthcare system often have it worse. And sometimes they're very frustrated with what's going on and often blame the clinician or healthcare professional that's in the room with them. And they're certainly not aware of the surrounding rules and the environment that we have to practice in, right? So, what are some ways that we can educate patients, or what are some things patients can do to improve the structure of our healthcare system?
I think that's really tricky because I'm a strong believer in general good health, preventive medicine, healthy food, and I think that should be a basis. And our American food is pretty horrible out there. So I think that needs to be cleaned up. But patients, I think, need to be, when you work with patients and you realize they're very frustrated,
Hmm.
I think you need to take a deep breath and realize that they actually, this is a financial burden for them, but they're scared, they're unsure. This is not their world.
Yeah.
You know, they might be losing somebody, and we have to take a big step back, a big breath, and explain and say, you know, we are here advocating for you. And if we can't do something, it's not because we don't want to, it's because the insurance maybe isn't going to allow us, but we will try something else, or I think a lot of just taking a few moments with the patient to explain, listen, I'm on your side, I'm part of
Mhm.
your team. We're going to try to do this because that's why I'm here. Now we got to do all the red tape stuff because unfortunately they hold all the power and strings. But I'm on your team. And I think if we really work with patients to help them understand that, hey, this is a you and me relationship, and we just have to deal with them somehow on the side because they are there, that would really foster a lot of improvement in patient perception.
You mentioned earlier about some tragic cases of workplace violence, right? So, talk more about that, and what can we do to help prevent future episodes and maybe de escalate some of the conditions that potentially can lead to violence in the healthcare workplace?
That's a big question, Kevin. That's a big one because I think the system right now, I'm not seeing a good way that that's actually going to get better.
Hmm.
I really am not, because I think patients truly feel very, very frustrated. This is a financial burden, this is a health burden to them. And I feel our providers, all of them, everyone from the techs watching, the monitors, to the nurses, to the PAs, the NPs, the physicians, the radiologists, everyone, the anesthesiologists. I think everyone up here is all burned out trying to do what we're trained to do in a system that really actually doesn't support letting us be free to actually take care of the patient.
Hmm.
So I don't see that the violence honestly is going to get much better, because that is such a big problem. With patients need someone to lash at, and we are the person right there in front of them.
Yeah.
They don't understand the complications of this corporate bureaucracy and all the money that's being made off of their illnesses. They don't understand that. It's really complex. So they're going to take it out on us. And until things change up here, and they are they're trying to work with getting rid of some of the pharmacy benefit managers and all that, because they just, that's crazy. I mean, everyone has stories to tell, but you know, the cost and the price transparency has to come back into medicine. You shouldn't have different prices and costs for everything where patients don't know the cost. We don't know the cost. It increases frustration across the board. I don't see this getting better until people up top get out of our fields, back up, and actually start saying, you know what, y'all are the experts. Y'all really actually maybe know what you're doing, and we need to actually start seeking your opinion and your consult in order to help improve our system, because it is so precious and so fragile and so important that it just shouldn't be treated so callously.
We're talking to Bettina Reed. She's a family nurse practitioner. Today's Kevin MD article is The Hidden Crisis in Healthcare, How Corporate Greed is Destroying Patient Care. Bettina, let's end with some take-home messages that you want to leave with the Kevin MD audience.
So I think my take-home messages are probably simply, have compassion for your patients. Actually take a moment, look away from your computer, and listen to them. Ask what their story is, because people feel unheard. We feel unheard. And support your colleagues. Sometimes there's a lot of banter because everyone is so stressed and overworked and tired. Really just support each other and back each other up. And don't be afraid to talk to management. If there's a problem, tell them it's a problem. If the insurance is being stupid, call them up. Say, listen, you know what? You don't have a doctor there to see this patient. I'm the one seeing them. You at some point have to listen to me, because this is my field. This is what I do. It's not what you do, it's what I do. So I think really just to get your confidence back and start advocating more for our patients and ourselves. I think that's important, because sometimes we're so tired, we just want to glide along and go home and get some family time,
Bettina, thank you so much for sharing your perspective and insight.
Kevin.
Thanks again for coming on the show.
Thank you.